Have you ever met this situation at the hospital?
Doctors, I'm having headaches for days and I couldn't sleep. Can't you help me check what is happening right now? I feel like dying.
Oh, is that the case? How about you go ahead and take a CT test first?
Okay, I will take the test first. Just wait for me. I'll be back soon.
CT scanning.
Doctor, I'm back. This is my CT scan. Can you help me check what's happening and when can I get my result?
Oh, you mean this? Young man, this is just a receipt for your CT test. Unfortunately, because our hospital is really classic, so we're using a PACS system that are 30 years old. Let me check. It looks like you have to wait another around 50 hours till your result can come back. So how about you just hang in there and maybe come back 2 days later?
From this case, the problems of the current PACS are obvious. Here comes our company Pacnosis to solve the problems.
Dear audience, have you seen that poor man who have to wait for 48 hours till the results? Relatively normal waiting time these days, as the PACS system today only replaces the work for film clerk, which means that it could only be a carrier of message rather than an active co-worker with the radiologist to process those works. For example, nowadays the PACS system are only used to communicate pictures, for example, from the CT room to the radiologist before they could begin their evaluation. However, this function is relatively limited. To wait for 48 hours in some emergency situation is totally not acceptable. As you can see from the poor patient Tang right there, if he was suffering from some kind of brain tumor or any emergency disease like that, to wait for so long of a time could actually pose a really serious damage on his health. So today we are proudly introduce our second generation PACS system, this Super PAC.
Our product Super PACS.
Hi everyone, our company is to save all the patients from their misery of waiting 48 hours, like the poor patient Tang over there. So although I know you may think I look like Tang, but I'm not. I am not that poor guy who have to wait 48 hours till he can have his ailment sorted. I am a much grand existence, and I am here to save them. So here our company's motto, our company's slogan is efficiency comes from categorization. So that defines our product, and that gives our product inspiration. So our product is called the Super PACS, and this kind of PACS system gives a way more efficient improvement to the current PACS product, like we have already explained before by Dr. Tony. And here I will explain how our product works, and this is it. So our PACS will put everything, it's like every individual profile into a system that they will have different categorizations, and we will basically have 3 levels of categorization so that the computer can easily extract information from our system and match the individual case that it is examining right now. So our computer will not only return the information you want, and also it will return a result. A computer self-generated a report about the current situation of the case. So the 3 level is like this. The first level is symptoms. So when a case comes in, like a patient comes in, and after he does the CT scan, the images and the information will be input by the doctors to the system, so that the system will kind of examine the pictures and examine the images. It will compare the image with healthy man's or woman's picture and find the differences between them. And if the computer identifies certain symptoms or certain abnormalities in the current case, it will return that symptoms, it will label that symptoms to this case. And then it will enter the second level of categorization, which is the kinds of illness. So based on all the symptoms that a computer finds in this case, then the computer will kind of search and identify what kind of illness is this patient is having. For example, after reading the Tang's CT scan about his head, the computer might find out that maybe it's a tumor, or maybe he's having other kind of illnesses. So based on these symptoms, it can identify what kind of illness that Tang is having right now. Then it will enter the third level of categorization. It's like for each kind of illness, we will have a pool of patients, which is all the historical data about all the patients that have been here who has the same kind of illnesses as Tang's. So in this case, it will be, for example, brain tumor. So the computer will examine all the cases of brain tumor in the historical data and about all patients, and it will examine them and pick out 3 to 4 most similar cases. And these cases will include the information like the degree of the illness, what kind of illness it is, and what type of treatment the patient was receiving right then. And it's like after comparing, the computer will say that okay, this case is most similar to the case that is before, and based on this case we can say that the best treatment might be using, for example, drugs or chemos or other kind of things. So all the examination is based on historical data, so that our PACS system actually the result is almost, you can say, it's very reliable. And after the computer generate this self-generated report, this report will go to the radiologist, so that the radiologist can make sure that the computer is not making a mistake. And this kind of process will make our PACS system actually a lot faster, because that this system actually have this report and all the cases that is similar to the current case presented to the radiologist, so that the radiologist, when they see this kind of report, they will have all the information that they need. And also it is more accurate because sometimes some subtle illnesses cannot be identified by human eyes. However, computers can scan through the images and find their subtle differences, and so that the radiologist may have a better view on the case. So that is basically the design of our products.
With Super PACS.
Come in.
Doctor, this time I'm having a stomachache and I really need to do some scanning right now. This time, don't I still have to wait 48 hours?
Okay, let me check about your status. Oh, it's much better this time thanks to the Super Pack. Your result will come out in an hour.